Hi, everyone. Again, thank you for joining me for this webinar, Impact Driving Patient Advocacy Sustainability. Most of you know me. My name is Sabrina Hanna, and I'm the Managing Director of the Cancer Collaborative. Advocacy has a profound impact on the patient communities we represent, but how do we drive change if we don't measure this impact? In this webinar, David Palacios will share insights on defining how to move into impact, transforming conversations with different stakeholders, and creating sustainability for your organization and your cause. David is a physician and health administrator by training with more than 15 years of experience in healthcare models for healthcare systems through HMOs in Latin America and the Ministry of Health in Colombia. He has more than 18 years of experience in the pharma industry as an executive leader at Novartis Oncology and Astellas Gene Therapies, leading the patient engagement and integration along the life cycle of drug development and commercialization in several therapeutic areas, including oncology, immunology, CV, neuroscience, respiratory, ophthalmology, dermatology, and rare diseases. David is passionate about elevating the patient influence and participation in decision-making through strategic alliances within the patient community, patient leaders, and patient organizations at local, regional, and global level, demonstrating the power of collaboration on common objectives and the possibility to co-create solutions with all interested stakeholders in healthcare. He's committed to supporting healthcare stakeholders' objectives and to contributing to innovative initiatives to maximize the impact on patients, caregivers, and society through a patient-centered approach as founder and CEO of InvolvCare Innovations LLC based in the US. David, thank you so much for taking the time to present to us today. Before I hand over to you, I just want to remind everyone that there is going to be a Q&A at the end of David's presentation. But I think everyone is familiar with the chat option, so you can enter your questions there, but there's also the Q&A at the top of the screen where you can enter your questions as they come to you. And I encourage you all to engage and ask David questions. And with that, I hand over the floor to you.
Thank you, Sabrina, and thank you everyone who joined today. It's a great pleasure to be here and share with you some ideas. The accumulation of so many years dealing with patient organizations and industry and healthcare has given me the opportunity to share some ideas around how I do see impact driving patient advocacy sustainability. And this is a recent kind of an exercise gathering, this perspective to help organizations to be more proactively involved in healthcare decision making. With that, let me just, you saw already some of the summary, my experience. Thank you, Sabrina, for the very comprehensive background sharing. As a disclosure, I don't have any connections or dependency of any company or any organization at the moment. I'm running this new consultancy organization, and it's give me the freedom to speak up and share ideas based on my experience. This is the agenda that we are going to cover today. So I found useful to share with you the global barometer of trust for a reason that you will see how it's connected with impact. Then we go through the healthcare impact framework, some elements about experiences from patient organizations that I used to work with, and I had a chance to connect recently in Latin America. And then moving towards impact, what the foundation for this, and then the cycle of sustainability. And then we go into the Q&A. So what are the global trends as a context for healthcare impact? So in this case, are you going to ask the question, Sabrina, or you want me to do it? There is a question here about what do you mean or how do you feel about trends? What it means for you, the word trust in your organization or what you do. If you can just give a word, what it means for you, the word trust. I assume Sabrina is backstage gathering the information from the audience. Okay. Any results so far?
I've got authenticity, integrity, credibility, reassurance,
Perfect.
security,
Important.
reliability.
There you go. Okay. So very good feedback from the audience. All of the above, I would say, are connected with what it means trust, but probably it's more comprehensive than that. I found this Edelman Global Barometer. It's a publication. They have been doing this for 20 years, every year. The 2024 is already out, but just capture the 2023. What you can see here um, in the slide is just a relevance of what had happened along the years, and how the NGO's influence was raised in 2001, right? So that is where the collective advocacy movement, the NGOs started popping up, despite the fact that many years back, oncology organizations and AIDS and whatever, but it just in terms of trust is became relevant, right? The other key date here is in 2015, when trust was essential to innovation. Again, they measure more than 100 of people among more than 80 countries, and they have this summary here. Canada was one of them, and US, of course, top countries in Europe as well. And then you see in 20, see that's having my covering my slide a little bit. Um, in 2018, the battle for trust is became one of those elements to be considered along the space. So what is happening today, as you can see the results in the 2023, is navigating polarized world is what one of the things that we are facing today across the world. And then you can imagine how trust is playing a role in this scenario, right? Now, if you translate that into healthcare, you will see that many of those elements matters. So how trust plays a role in the relationships, in the partnerships, and how collectively different stakeholders play a role to overcome challenges in healthcare. Now, this slide is showing that despite the different opinions, the government, media, businesses, and NGOs, still NGOs in this measurement has a good view from the public in terms of a trustful source, right? Um, this is a positive signal, right? That you need to consider when it goes to the context of NGOs and the patient organizations that you represent. Again, this is a very global observation, but just wanted to highlight the process, the thinking, and how you will see yourselves, those who are leading an organization in the field of healthcare, about trust, because this is important. Now, if you think about the societal determinants of impact, again, this is a very succinct summary of many, many complexities behind that. But if you think about social, again, in the context of healthcare, you will think about trust and equity are one of those elements that need to happen to avoid a social crisis, right? Would you agree with me? When you move into healthcare, you might consider access and affordability, or accessibility if you want, to as a critical element to avoid the healthcare crisis. Some of the elements that I gathered prior to this call about the system in Canada is that every province, they have their own process to provide access. Innovation is coming out of different countries, and the process to get this innovation accessible to people is different in every province in Canada. So again, do you feel that there is a crisis in some areas, maybe in oncology? What is the role that you can play, and how do you can evaluate the changes that need to happen to have a better access, right? Including health technology assessment as one of the many, but also the infrastructure, the talent, the resources available, how the government is allocating resources and prioritizing some elements that rather than others. And when it comes to the dimension of a management, that again is applicable to management of healthcare in general, the players, hospitals, resources, physicians, offices, technology, services, whatever, always leadership is key and capabilities to deliver those services is key. Now, in your context as patient organization leaders, you might find yourself what is your leadership role in the healthcare system and what are the capabilities that you are putting together to be part of the equation, right? Okay. Let's move on and talk about the framework itself. So I just wanted to use a very generic definition of impact that you might rely on, which is in healthcare, impact is changes in health outcomes resulting from exposure to a source, intervention, or a service. Now, you might find plenty of other definitions, but if you don't make a change, you don't impact anything. And the change could be motivated or generated by different possibilities, right? Again, you apply that in your context, and then you will see what happens in healthcare today is we focus on patient outcomes, healthcare outcomes, and societal outcomes. Probably the societal outcomes are less handy for us and less kind of a priority for many of the stakeholders. But according to where you are, you will see where you fit, right? When you think about patient outcomes, primarily clinicians are thinking about clinical outcomes. Some of them are thinking about the psychosocial outcomes, less in the well-being outcomes, and how whatever intervention in healthcare is minimizing risks. All the efforts from authorities when they approve an innovation is to avoid that there's no harming, is safe, and is working well to, improve patient outcomes, but minimizing risk of side effects, for example. When you think about healthcare outcomes, you're focused on access to health services, right? It's more systemic, right? Healthcare navigation, which is the best way to use the healthcare system, wherever you are. Effective quality of innovation, which means that whatever is accessible or available to manage diseases, to improve testing, whatever is in your condition, is effective, right? And it's cost effective if you want. And that is coming to the last one, which is the affordability of care. So what are the different elements around healthcare that make this affordable? And sometimes affordability is not about more money. It's about efficiencies in the system. It's about the commitment of physicians and the commitment of patients to make the right things, to do the right things. But when we go to societal outcomes, it's more challenging because how much healthcare drives equity, or how much equity is implicit in healthcare. So something that you need to think about. And if you are in a province that is far away from the most of the technology is accessible or affordable, so what would you do, right? As a leader for your community. How transparent is the process to incorporate technology or to say, no, there's not accessible, or no, there's no reimbursement for this or that? How transparent is that process to will have implications in societal outcomes in general? How do you measure the quality of life implications of not having the right services or the right healthcare, approaches here? And then finally, what it implies for the society overall in terms of productivity when you are sick, when you don't have access to the right treatment, or you are not accessing at the right time, and then you lose, as a society, a lot of productivity in general. I think this is a clear context for you to think which areas would you consider that you and your organization will focus on impact, okay? The next one, I'm going to share with you what just happened recently. I was invited. There's a Latin Alliance of oncology and hemato-oncology and other rare disease and other organizations in Latin America, and they invited me to have a chat about this topic. And we asked 80 organizations to provide their feedback about how do they see impact. And this is a question that I would like Sabrina to ask you all, and you can provide your 2 words in terms of how do you see impact in your organization today?
So I've got a couple of comments. I have policy outcomes,
Okay.
both healthcare system resiliency and patient outcomes, and policy change and patient outcomes.
Okay. Super important. Absolutely. Now, let me share with you what had happened. And again, you might rely on some of the, or connect with some of the responses here. When we ask them how the organizations recognizes impact, 80% of them are focuses on accomplishing their objectives, which is key. Now, the other point is, what are your objectives? Is our objectives related with real impact or something else? But accomplishing an objective, yes, for sure, that will imply that if you design the right objectives, you immediately will kind of recognize impact. But the other fascinating response was showing the benefits to educational campaign, right? It means that in Latin America, many of the organizations are still in the face of spending a lot of time and resources in education. Again, that could be similar or not that similar than in Canada, but is something that organizations spend a lot of time in Latin America. And then other elements to recognize the impact is connected with the right operational funding, the access to the services for patients, the growing in the terms of patient memberships, or in the achieving particular tasks. And I'm going to mention one of the elements about the tasks, because when you're focusing tasks, sometimes the tasks are related with projects that are not necessarily related with your priorities, because the funder might say, I would like you to help me with this. You can do it, you get the money, but it's a task that is not necessarily compelling enough for what you want to achieve as an organization. Having said that, so let's move to the next one, which is, what are the measures that you consider to rebel, what are the measures that you have for impact? Put it that way, simple. Any comments from the audience, Sabrina?
Yeah, I've got increase in timely access to available treatments for patients.
Hmm?
I
Very important.
responded to say not measured in a defined way, which is why I'm hosting this webinar.
Okay, that's good.
I've got another comment here. Increase uptake of a preventative action in high-risk populations by convening, catalyzing, and driving policy work and promising evidence-based approaches.
Okay, very complex one, huh? Okay, so this is what the Latin American organizations responded in this exercise. As you can see, it's not easy to realize how organizations measure impact. For some, 37%, they measure impact about the likes in the website, which again, you can argue maybe you have similar mechanisms or not, but clearly is not necessarily a measure of impact based on what we just described in the framework. But 40%, they measure the number of patients who are receiving treatment. That's a good one, right? And that's a compelling one. The rest are connected with the number of events of activities executed, which is more kind of a management measure, or the proportion of the independent funding, which is a source of independency. You can measure independency in a way, but are you really measuring impact based on the framework that we defined? Or the number of clinical guidance improved, which is an interesting one, because the way that the guidelines are improved as guidelines, it doesn't necessarily be translated in changing the reality. It's a good step towards that, but then if you want to measure the impact of the guidelines, you need to measure something else, right? Patient outcomes primarily. Okay, so this is a good reference just to move into what we call the moving towards impact. What is the action behind this, and what do we need to know and how we need to approach it? And just to to be clear, to set expectations, I'm not here to give you all the tools that possible regarding impact, because there are many possibilities, but just to give you a frame, is give you a reference, and mostly talk about the foundation from my experience about how you can really move into impact. Okay. And this is one of those kind of a collective elements from my experience regarding the observations among many type of patient organizations in different geographies, different disease areas. And those are simplified and very succinctly simplified. There are many more eventually elements here, but from my point of view, there are two dimensions for self-assessment that you need to have in mind. First is your capability. So first of all, based on your structure, you have a robust structure, uh, too much based in volunteers, or you have a formal capable talent in your teams. And the funding, of course, is your ability to drive initiatives, projects, etc. And how do you manage those, right? The management piece is also critical. And again, I've been seeing good successes when these three elements are properly managed, and failure when they are not, right? So again, it's a simplification. This is kind of an internal side of it, right? But the other assessment that you might have is when you reflect yourself against the external world, right? How do they see, other stakeholders see you in the leadership role in healthcare? Are you visible? Are you relevant? Are you invited to be part of something, right? Discussions, tables, round tables. Do you have publications? Do you have articles? Are you visible in the media? Whatever it is, that shows some kind of a relevance of your organization, and how do you represent, which is the people. That's why it could be memberships, not necessarily as a formal registered members, but how many patients do you represent? And I learned years back from one strong leader that passed away already, that the bigger asset of a patient organization are the people who are part of it. So again, membership is quite relevant because when you talk to governments and officials, now that you have been talking a lot about policy, if you don't have the ability to represent others as an advocate, that's a big problem, right? In terms of credibility or trust. And then what do you cover? You cover services, basic services, so you cover policy, you cover decision making, you cover medication support or psychosocial support. What is your coverage from one side in terms of what activity, but on the other hand is your geographical coverage. Is you represented in Ontario or in whole Canada? Are you member of a global or regional network? Those kind of things matters when it comes to be seen as a credible source, as a trustful source, and in with the dynamics to influence impact. Then focus on these three dimensions of impact that I highlighted here. Many of you already mentioned it. Public policies improvement. There's no question, and it happens all over the world. Every single country in the world today is talking about how they can improve public policy regarding healthcare. Question would be, do you have in your objectives, in any of your objectives, your role to contribute to that possibility, right? That's an important piece of impact. Of course, the second one is critical. Everybody's talking about it because innovation, technology is growing so fast and is providing so much opportunities and expectations and hope to many people that it's a shame that we won't be able to capture and incorporate that technology in our systems, right? So access to health services and innovation is critical. How many of you have kind of a measure or an objective related with this particular topic? And the last one, which is again becoming a critical version of what is possible to do. Everybody's complaining from the patient perspective that everybody's making decisions on their behalf. Now there's a big movement, and the whole patient-centered approach is giving the opportunity to patients to be part of that discussion. But are you prepared? What are your steps to be able to participate in decision making? Are you having plans or preparation to be part of it? Again, this is something to think about when it comes if you want to make impact. Okay. Now let's go into the foundation. What is the foundation for this to happen? And you can apply sophisticated tools, artificial intelligence. You can apply having the supermaster leader in one and another organization. But again, along the years of experience, what I can gather, if you want to achieve impact, are in two simple buckets. One is mindset, and second is method. If you miss one of those two, I can guarantee that it's super difficult to achieve any type of impact. Now, let's go specifically about the mindset. Why mindset is so critical? When you deal with patient leaders in the communities, they need to believe and act as a change agent. If you are not really projecting that possibility, and everybody's talking about the passion of the patient leaders in the community, fantastic. You need to ensure that that passion is translated in your need or to represent others for a change. Because impact, as we saw in the definition, by definition, is you need to find a change for improvement, for better access, for better outcome, for whatever you want. So that's the first thing that is in your mind. The second element is how you translate and define what changes do you want to focus on. What are the things that matter most to patients, and reflect those in your plan. Otherwise, you might have a rhetoric discussion about what do you want to do, how do you represent, but then your objectives are not consistently aligned with that. Then you have a problem in terms of impact, because you can start spending resources, time, and efforts in something that it won't modify anything, right? As I said before, could be a task, could be an activity, is not going to be aligned with the impact that you're looking for. That's why you need to really define what are the changes and focus on those things that matter most. The third element here is, again, basic, but is very systemic issue across healthcare, and the role of patient organizations is about the narrative. How do you use and articulate a narrative that is influential enough for you to orchestrate the change? And again, that could be a big challenge for many if you want. But again, think about your own purpose, your reasons to be a patient leader or patient organization, and how you are articulating what you want to achieve, right? To others, because influence here and change includes the engagement with other stakeholders in healthcare to eventually provoke that change, right? That is super important, implies leadership, knowledge, preparation, whatever. But even I can tell, against all of those sophisticated elements, you can be a super passionate leader without even a super strong structure in your organization, and you might be able to articulate a narrative, and you can achieve more than others that are more sophisticated in the structure. Just to give you a reference, okay? Mindset is key. Now, let's move into the second key other foundation to achieve impact, which is method. Method implies that you define short and long-term measures of impact, because, as you notice, if you want to have a patient outcomes of impacting patient outcomes are different to impact societal outcomes. Some of the outcomes that we are looking for might be longer term, and we cannot avoid them just because it's long term. One of the observations is that most of the budget's execution in the patient organizations are monthly, sometimes is yearly as the most. Even if you have a 3 years plan in a good scenario, your execution is based on what you can do in 1 year. This is not necessarily out of the reality, but or preventing you to achieve impact. As soon as you articulate year after year the milestones, you achieve one thing, building blocks kind of exercise that you know what you want to achieve year one, year two, and year three consistently, and you move to that line. And at the end of the day, you can achieve the impact that you want. It's not going to happen in most of the cases in a short period of time. Right? The second element in the method is how would you prioritize the interventions and the execution, and how you will document those interventions and execution. I've been a little bit, I have to confess here, a little bit frustrated getting to know amazing activities and work from patient organizations in the global space. When you ask them, how do you document what happened? What are the impact, the beautiful campaign that you did, educational campaigns that you did, reinforcing access to diagnosis or early diagnosis, or even treatment? Do you have any way to document what you did? And the big frustration is in many cases you don't have it. Don't have the documentation or the demonstration of the impact that you achieve is lack of method for you to show the baseline, what happened when you achieved, when you started dealing with an issue, and all the interventions that you put in place and the execution demonstrated that you make a change. And that's the impact you need to show. If you don't have that ability, you're missing the point, right? And last but not least, regarding method is what instruments you want to use to measure impact. And again, here you can have another session. Happy to work with Sabrina on that in the future. But what are the instruments that you want to use to measure impact? I mean, again, you can start from surveys, but you can have, data, devices, regular interactions, interviews, forums, roundtables, but you need to define how would you like to use those instruments to measure your impact. Okay, so we are getting to the point of understanding what impact means, what are the contexts in healthcare, what are the relevant elements in your organization to move in that direction, and what the foundation for impact. Now, let me just articulate what I call the patient advocacy sustainability cycle. And this cycle is just coming back to the origin of trust. But again, you start by defining clarity of your objectives and priorities. Again, keep in mind that sometimes you try to do everything. It's not possible if you want to achieve impact based on your own capabilities and capacity. So focus on the things that matter most, as I said, and try to define an objective and prioritize on those that will be able to provide impact or to measure impact. Then, of course, you move into what is the strategy to make that happen. And again, that is not just to tell you a basic kind of a management course here, but it's sometimes people jump from objective into action, into activity. Are you really articulating the how to do it? What elements you need? Who can be your allies? What other stakeholders need to be part of the discussion? What other talent or competencies you would need to execute these kind of things? This is important, and it doesn't mean that necessarily it will be more expensive or costly or complex. But if you don't think about it, you will miss the opportunity to really get to the right timing or a powerful impact in your measurement. Then, of course, whatever you define to do, you execute it, right? And then you measure whatever you can measure. You don't need to measure all the criteria, all the elements, but pick and choose one or two where you feel that you can have the tools to make that impact or to make that measurement. And then document it. When you measure the thing, you translate it into a document that could be a publication, could be a summary, could be a report. Many of you, most of you, I would say, you build your own annual reports. How many of those reports are really showing the impact that you make rather the activities that you execute on how you manage your budget or how you achieve more members? Are those the real impactful things that you want to show in your report, or you would like to include real impactful changes based on your efforts and your collective efforts and collective collaboration with others? Then you have that documented. What happens is you need to have the recognition. You need to leverage those results and to get the recognition for those achievements. It's media recognition, your membership recognition, the public recognition, the government recognition, the clinician recognition, whatever is your space, you need to make that clear for them that they can say, oh, okay, that happened because this patient organization applied this intervention and helped us to move into the next level, right? Then I can guarantee that the funding will be there for you and the growth will happen. I've been, again, seeing too many organizations doing amazing projects with limited impact or even having impact without being able to demonstrate that impact. And then when you go to the iteration of a cycle of funding, either way, your sponsors, they don't see it despite the effort, or they don't value it. Whatever it is, it's an issue, right? But I can tell once you achieve minimal things for your community, for the healthcare system, in alignment with the stakeholders around you, the funding will be there for you and you will be able to grow. All in all, come back to the basic thing. If you do this consistently, there's no chances that people won't trust on you, on what you do. And then the cycle is started, right? Trust is one of the more difficult things to build, take a lot of time and effort, and it's easy to destroy. But once you have trust, you open avenues for many things. Collaboration with one, funding is another one, support from people, you name it. And that is something that I would like you to consider in your moving forward activities and make sustainable, make you sustainable because the people that you represent are expecting you to stay. And to stay, you need to be sustainable. Okay, so let me think if we can close with this reflection. I was very honest with Sabrina that I don't remember where I gathered this reflection, but it was really, really impactful for me when I read it. Because it's also applicable in a personal context if you want. And it says that the vision without an action is a dream. An action without a vision is just a passing time. But a vision with an action can change the world. Again, you can say and argue that are just words, but if you incorporate those words in your mindset and in your management and in your collaboration and in your alignment with the different stakeholders in your space, I can tell you that you will move into impact and you can demonstrate the value that you have in your society, in your community, and your space. With that, I'm gonna thank you for your time, your attention, and let's come back to the Q&A.
Thank you, David. I've got a sheet full of questions. I'm going to try not to be the one who's going to ask all the questions. So please, if you've got any questions, please put them into the chat. We talked about policy change being one of the measures of impact. The policy change doesn't happen overnight. It's like it's something that takes a long time. So how do you measure that when it's not something that's happening? It's not happening frequently and it's not happening quickly.
Very good question. And again, I just appreciate the fact that many of you in the audience are trying to make that impact in policy. To impact policy, you need a lot of consistency because, as you said, it's not something that will change overnight. And players could change overnight. So you are not, but other players might. So again, if your policy, for example, is to have or contribute to the province cancer plan for a particular indication, you need to start building blocks exercise to say what will be the first step to get there. Are you connected with the right people? Are you sharing your right objectives? Do you have the right narrative? Are you part of the conversations? If you are not, of course, there's no chances that you to influence at that level, right? But it doesn't mean that you have to be in every single conversation. Then you might say, okay, There's no clarity in terms of what is the reality here. So I'm going to create evidence, working with my community to show and create evidence that will be the reference to open the conversation. That's another mechanism, but you can do it, right? You create evidence and then you start inviting people to have a dialogue to show the reality. One of the elements beyond even the narrative is your ability to document and show data. Nowadays is becoming more and more, it's becoming more critical. And again, I also do appreciate, and I was in this rare disease space, super terrible conditions. And yes, you can argue that one patient, one caregiver, one mom telling the story about a kid with suffering a genetic condition is terrible. Fine, yes, but to change policy, you better identify how many of those kids are in your province and what is the suffering, what is the quality of life that they are facing, and what is the issue with them that you can document a little bit and then move into a discussion. Maybe some of the industry colleagues or former colleagues are here in the call, but I can tell when you start measuring the patient journey, you ignore half of the journey because you start when, oh, patient is diagnosed, so let's assess the journey now. But there is a journey that the patient, nobody will document but the patients. What happens when you are lost? How many years you spend trying to find the right diagnosis, the right specialist, and you continue suffering, right? So again, it's just documenting what you can, but focus on what is important for you and don't expect that will happen tomorrow, right? But you build that block and then you move to the next. And you build that block and you move to the next. If you have the data, guess what? You will be credible enough to talk about it if people didn't, didn't pay attention to you before.
Yeah, and so just to follow up on that, for organizations, I mean, there are some organizations are machines, and there's a lot of people, and they have the ability to do that. But when you're a small organization, for myself, for example, I'm just one person. So how do you like? What tools are like? How do you suggest we move forward on doing things like that? Because the things you're talking about, it's like to go and look at the provincial plans and get a voice at the table and make sure I'm there. Is I'm just one person. I can't do it all.
Very good question, because that is giving me the chance to tell you, you are not alone, but you need to find the right allies that will allow you to achieve that common goal. I can guarantee this is a common objective. It's not going to be just you thinking about the same. Many of people in this call will have the same ambition from different lenses. How do you build those connections and start working with industry or government officials or other? I love your collaborative name because this is exactly what it is. You open that door to communicate what you need to communicate, but you need to build your narrative. You need to have clarity about your objectives, because without that you get lost and you won't get any traction. You talk to people and people are saying, oh, nice, Sabrina is a nice lady, just running their own thing, and fine. But you see, you build your objectives, strong objectives with clarity. You have members of your community, you get them as a back support, and then you start explaining to others and find that consensus about, is that a relevant thing for all? Let's move on, right? It doesn't prevent you to leave that. And then when I was saying orchestrating, because I would say the only stakeholder that suffer across the whole healthcare is the patient. The rest are pieces. Government is pieces about the budget constraints, and the clinicians about the science, and the hospital kind of a services that they can provide, or the research. But the only member of the stakeholders in healthcare that suffers 360 experience is the patient. That's why a good narrative from the patient perspective, to argue with others and convince and engage with others effectively, is the key. Nothing, not saying that it's easy to do, but is a way to do it, in my opinion.
And so just because I'm just the one person, I do rely on my industry partners a lot, and whether they're funding me or they're not funding me, I do rely on them. But I do find that because I'm just one person, and well, I guess actually it doesn't even really matter that I'm just one person. As an organization, I have objectives that I want to achieve, but I don't always get the funding to achieve those objectives. And so it's just like I mean I see what you're saying, and I'm like, okay, there are things I need to start doing, even though I'm
Mhm,
just one person.
mhm, mhm.
But so as like one or as an organization who doesn't get the same amount of funding as, a bigger organization, or, organizations that have been around longer, like how do you, like there's a mismatch, between the funding that I'm receiving and the ability to achieve all those objectives.
Very good question. And again, based on my experience, I use the word translation as a mechanism to get easier an alignment between what the organizations are looking for and what the industry or sponsors are looking for. I can tell you, we can pick and choose examples of different things, but normally is the same issue or the same intention to achieve something, common objectives, but it's seen from the different lenses. And apparently it looks different, but are the same. I'm going to give you a general example, which is very common. Uh, Industry or companies might offer you, oh, we want to have a campaign to create awareness. I want the patients to be part of it. Sometimes you are early involved that you can provide insights to them to make the right kind of a balancing campaign. Sometimes it didn't happen. However, the objective might be similar, right? What is the type of conversation that need to happen to really get to this common space that you feel that whatever approaches they're having are going to contribute with what you're looking for, and vice versa. Sometimes there's a very kind of managerial position of a company saying we want to achieve X, we want to work in mortality, or we want to go in the impact of this eventual innovation in XB, which is not exactly what you have in mind. This conversation need to happen for them to realize that mortality is not against what you want, but they might consider your angle as well, as they want to have the community embracing it. Normally, community in oncology, they look for hope, right? Not for death, right? So, but again, sometimes it's how you translate pieces here and there and enable this dialogue to happen. And we get for granted sometimes even the role in the companies that somebody are dedicated to patient advocacy roles, and the medical is assuming that they can do it, but it's how you can translate, make the right translation to find this common ground and work together. This is probably my suggestion.
And so, I mean, just coming back to the sustainability piece, right? So some organizations, most organizations will get their funding from industry partners, but they'll also get, from public and private. But for those of us who are relying on that industry funding for our sustainability, like just help me walk through this, because I am one of those organizations that does rely on industry funding for my sustainability. So when we're talking about patient advocacy sustainability,
Mhm.
especially when it's so attached to industry, like how do we stay sustainable, especially when industry funding every year gets smaller and smaller and smaller?
There are two elements. One related with the industry as a unique mechanism of funding, and the second one is how you can expand your abilities to get funding from other stakeholders in the space, right? And it's true. It's a kind of a paradoxical story because it's a very legitimate relationship when it comes to industry and patients. Is highly scrutinized, so you better have more than one company supporting you. Um, but then is again going further this kind of a um, project-based relationship, because I can guarantee, and there's a beautiful example, one organization that matter they decided to create what they call observatory for pediatric cancer change. And they managed, because it was pediatric, because it was cancer, but this unique organization managed to gather in with the sponsorship of several of the partners in the industry, a bigger scope with other stakeholders, including the government, including provinces, including the academia and clinicians, to focus on how we're going to address this. In other words, to make this a simple answer, the bigger the objective regarding your purpose, the bigger possibilities that you have to include others. And when you include others, even governments could put money behind. And again, I understand you are the only lady driving everything. It will be difficult, but again, it's all about to define what your mindset, what you want to change, and define what will be objectives. Even though those objectives seems difficult to accomplish, if you want to address it, build your narrative, start connecting with your partners in the industry, and find out through them or with them other potential supporters. And then the money, I can tell, could come. It's a little bit of a method. You see, again, come back to the basics. What is the method that you use to make that happen?
Yeah, I feel like I'm gonna have a lot of discussions with you offline about this. But I just wanted to ask because I know I had the opportunity to meet you when you were at the head of like patient advocacy and stakeholder engagement and Novartis Global. So in that position, do you have examples of patient groups who were measuring their impact well?
Yes, I had to say that some of them we were working with them to get to that point. Um, there are some that are already well established and they have their own agendas, mostly in the US. They are sophisticated patient organizations run, the funding is coming from donations, which is a different fundraising experience that in Canada and many other countries, who gives them the ability to do so, right? But having the average kind of equivalent kind of a market size type of small organizations, um, what I found interesting is when again you find this common ground, and I'm gonna give you an example, tangible one. Um, I don't know if in this community there's ankylosing spondylitis members of the community. It's a rheumatological disease, really challenging. There's a global platform of patients internationally, and when we started talking to them and finding this real, where do you want to go with this? So what do you want to achieve? It wasn't clear for them. So they were focused on in access to these technologies or treatments or whatever. But then what is missing? And one of the common elements that we found together was there's no clarity about the issues that the patients are facing in their regular daily life. Despite the fact that you go to the experts are not catching it up. I'm not talking about intimacy. I'm not talking about the length and the difficulties for them to move and the tiredness and different things. They focus on the clinical aspects of it, which is very straightforward based on the treatments. To make the story short, we agreed together to build evidence that showcase that reality that didn't not too many people really have. And then of course it's a combination of them structuring themselves, we advocating for them internally to get resources and try to combine from different other sources and allies like universities. We find an ally in a university that was super compelling to help us with the methodology, the gathering the information, made this survey a global one. And what happened at the end of the day was that they managed to get the results in a way that they could leverage and make this visible to clinicians, industry. Industry won because once people used to stay in the standard of care at that time was, anti-inflammatories, whatever, they move into biologics because they noticed that there's other well-being psychosocial dimensions beyond the clinical outcomes that are critical for patients. That you see, and let me tell you, that was 3 or 4 years work, long term. But those are examples where you can see, and again, with the willingness of the organization, maybe they weren't full prepared for that, but we embraced them, we worked with them, they took the challenge to make that happen, and that worked. And there are more than one example, but
Well, we're just coming up on 3 minutes to 3. So I don't see any questions coming in, unfortunately. And I think I've asked enough. But I feel like from this conversation, I know that I'm gonna go back to the table and really start thinking about how I'm measuring impact and how I'm defining the success of the organization and how I am staying sustainable and making sure that I'm going to be sustainable moving forward. So I really hope that everybody listening in feels the same way. And I invite you, if you do have questions, if you want to ask David about some of the measuring impact tools that you said that we could do on a separate webinar. If you have some questions about that, I encourage you to email me and I will ask David the questions and we'll see if there's interest in doing a second webinar. But with that, thank you so much, David. Thank you for giving me more work to do.
My
And
pleasure. But again, you're able to focus on what is critical, and you will be able to find the space to do it. No question.
yeah, yeah. All
And
right.
thank you all for being here with us today. And hopefully that will help them to help you to move on.
Yeah, and I will make sure that the webinar will go up on the Cancer Collaborative YouTube, so you can find it at Cancer Collab on YouTube and on the Cancer Collaborative website at cancercollab.ca, and that'll go up next week.
Excellent.
Thank you, everyone. Have a great afternoon.
Thank you very much. Good to see you all. Bye-bye.
Bye.